Hello, today I would like to talk about preeclampsia and environmental toxins. And if you already are familiar with preeclampsia, you might be wondering what those two topics have to do with each other. You may already have a few ideas about it, or you might be really skeptical about how preeclampsia might relate to environmental toxins and think that probably they don't have anything to do with each other. So I am Melinda Delisle. I'm a clinical nutritionist with a master's in human nutrition. I also have a background in childbirth education and as a doula. I first started teaching childbirth education classes back in 2000. I'm absolutely passionate about reducing the risk of different pregnancy complications. And since today is the day I'm recording this is Pre-Eclampsia Awareness Day in 2022, I wanted to go ahead and approach this topic because I have done quite a bit of research on it. And so we're going to talk about what is actually in the research, what have other researchers done on this topic. So let's go ahead and get started. And this is actually going to be the first of a 5-part series. Today, we're going to do a bit of an overview of what are the different categories, what is preeclampsia, why might they have something to do with each other. And then in the next 4 parts, I'll go into each of those types of environmental toxins that seem to have an association with preeclampsia that seem to increase the risk of it developing, and get into more of those details about why that is, what they've found, and what we might be able to do about it. It's not going to be super deep, and I'm going to be talking about this both from the perspective of if you're a pregnant person and you want to learn a little bit about this. Probably, honestly, this video will be the most helpful for you. The other 4 in the series, we're going to get a little bit more into the weeds in the biochemistry and research speak. So as a pregnant person, this is probably going to be the most helpful one. If you're a practitioner and you think that this video is a little bit too general, you'll enjoy the next 4 because we'll get into some of the fun stuff there. I'm a little bit of a research nerd, so to me, all the biochemistry and the nitty-gritty is actually fun. All right, so first, a little bit about preeclampsia. Worldwide, preeclampsia occurs in up to 10% of pregnancies. Some countries, the rate's lower than others. That may have something to do with some of what we're talking about, but there are lots and lots of things that contribute to preeclampsia. The fact is, there's not an exact cause that's known. Researchers at this point think that there's a lot of different things that can cause it, or more likely it's a combination of a bunch of different factors, and they call that multifactorial, as part of why it's so hard to pin it down and so hard to prevent preeclampsia. We do know from research that they've done on the biochemistry and how the body works that it involves abnormal liver function, may or may not also involve placental function, inflammation, and usually seems to have something to do with cardiovascular risk factors like high blood pressure, something called endothelial dysfunction, which is actually the lining of our blood vessels, and things like that. We know that genetics play a role in at least some cases, but we don't know how often or exactly who's at risk, though they are doing a lot of research on that. So we're learning more and more about that like every single year. We do also know that there's a significant amount of research on an association with, and in some cases, increased risk of preeclampsia with certain types of environmental toxin exposure. So there's 4 different categories that seem to impact preeclampsia. One is endocrine disruptors. What that is it is chemicals that change how our hormones work. Specifically, most often they talk about estrogen being the endocrine disruptor, the hormone disrupted by these chemicals. And obviously, since estrogen is the primary hormone that is functioning in pregnancy and maintaining the pregnancy, you could see why that might wind up being an issue. There are other hormones disrupted by endocrine disruptors as well, but we'll get a little bit more into the details on that in that part of the series. Heavy metals also seem to have a big impact. This is things like cadmium and lead and tin, things like that. The most impactful of those seems to be lead. And there are actually really easy things that you can do to help reduce that risk. Again, preeclampsia is really hard to prevent. So everything we're talking about when we talk about tips and things to do, it reduces risk. We can't necessarily make it go away because we don't know really who is going to have the issues, though call to research here. I would love to do some additional research at some point on how can we get really specific in what the risk factors may or may not be for individual pregnant people, and then how can we approach that, and can a targeted approach really have the benefit that it's, if you look at the bits and pieces of the research, it looks like it might. So back to the list. Third category is oxidative stress. This has to do in a super quick overview fashion. Oxidative stress is what you might have heard called free radicals. Basically different things in the environment, in the way we eat, in just aging, things like that, cause stress on the body, and the body needs antioxidants in order to be able to work with that. You can get into a little bit more of the biochemistry, and that there's an antioxidant called nitric oxide, and that is actually one of the ones that helps our cardiovascular function be maintained properly. And that seems to be one of the main issues, though there's other antioxidants that get involved as well. So that winds up being an issue and is associated with increased risk of preeclampsia as well. And detoxification overload. Now, this is not necessarily a specific kind of toxin, but it's more a category because research is suggesting that people who have issues with detoxification are more likely to have problems with their system getting overloaded. And it doesn't necessarily have to do specifically with the exact kind of toxins, though it can be any of those three previous ones. It has more to do with the actual detox system itself. Obviously, it's going to be combined with other issues. And obviously, really important caveat here, do not ever, ever, ever do a detox during pregnancy. Okay, I don't care what somebody tells you. It is not something you don't want to do, like detox drinks or just like, nah, this is bad. Okay, so don't do a detox during pregnancy. That is not what we're talking about. This is it's a very specific way of approaching things, because you don't want to release additional toxins from the body that the body then has to deal with. So, all right, so that's the super general overview. To keep this particular video short, I want to give the pregnant people and any practitioners or childbirth professionals who want to share these general tips with the pregnant people that you work with. What are some general ways that you could support these processes? Now, these are not specific to any of those categories. They're actually additional tips we'll be able to give that I'll give in those future videos that are specific to those other categories. These are just things that anybody can do. Okay. Some of the other tips that I'll give in the other videos, they're very specific to someone who actually seems to have that risk factor or that exposure. Here, this is general. So everybody, preferably before pregnancy, but definitely during, you want to reduce your exposure to toxins in the diet and in your environment. There's all sorts of lists for this. I actually have some lists as well and tips and ways to do that. So you feel free to contact me at confidentpregnancy.com or through one of my social media channels to get that as a handout or get more information with that. And I'll probably also do some episodes on that in the future as well. We want to eat a diet rich in fruits and vegetables. Lots of antioxidants. There's also nutrients in fruits and vegetables, specifically green leafy vegetables, to help support the detoxification because of something called methylation. You may have heard of that if you're at all familiar with MTHFR and methylation issues. And as long as they're fruits and vegetables that you don't have any allergies to, you don't have any issues with, most people can eat more fruits and vegetables. It's a very easy way to support your body in getting the nutrients you need as well as antioxidant support. Take a high quality prenatal vitamin. Remember that a prenatal vitamin is not replacing a poor diet. It is additional nutrients to supplement what you should be eating, because sometimes we don't absorb things as well. Sometimes our bodies might be deficient in certain areas, and other reasons why it might be challenging to get enough nutrition from even a high quality diet. Drink enough water, stay hydrated, keep things flushing through. Another thing that water does that's very, very helpful is if the body happens to be pulling some toxins out of the body that have been stored, it also helps flush those out. So drinking enough water, it makes sure that your body's flushing out what you eat that it wants to get rid of. It's helping flush through anything your body is trying to get rid of. Our bodies actually create toxins all the time. They create waste products, and we need to get rid of that. And drinking enough water helps flush that, not just through our urine, but it also helps make sure that we're support our bowel movements moving through. It doesn't guarantee it. Obviously, constipation is an issue for many of us during pregnancy, so it's not guaranteeing anything. But if you're not drinking enough water, that's almost a guarantee that you will be constipated. So you don't want that. Keep things flushing through in all ways that you can with staying hydrated. And making sure that you eat enough protein to support those detoxification pathways, in addition to also helping build baby and build the extra tissues that your body needs. You know, you're also growing the placenta, not just the baby. You're growing the extra blood volume, not just the baby. So these are all things your body needs protein for, and protein helps, you know, work with the liver and the detox pathways as well. All right, so if you're a practitioner or a childbirth professional, or you want to know how someone like me would approach looking at how can we help reduce the risk of preeclampsia in individual pregnant people, this is generally what I think is important. All right. First, we want to look at what potential environmental toxin exposures do you currently have, and what have you had in the past? Okay, what you've had in the past can be really important for things that tend to stick around in the body. Lead is a really, really big one with this. Again, we'll talk more about that in the episode in this series that'll discuss heavy metals. But lead, other heavy metals, they tend to get stored in the bones. Some of the endocrine disrupting chemicals and certain other toxins will get stored in fat tissue. You know, so as our bodies are recycling the fats, and sometimes if we lose any of that fat during pregnancy, those chemicals can be released, and then that winds up causing an issue. So knowing what the current and the previous environmental toxin exposures are helps us know which things may come up as issues. Okay. With your doctor, you want to evaluate measurable risk factors. Okay. Functional health practitioners, your obstetrician or midwife, you can measure and look at certain things like, how is your liver functioning? How is the cardiovascular function? Is homocysteine high? Is the CRP high? Are there measures of inflammation? There are things we can actually measure using blood work to look at, are there problems or indicators that there might be a problem because the body is starting not to work so well in those areas. Okay, that's somewhere we want to be aware of, or something that we want to be aware of. When possible, we want to try to determine any existing genetic SNPs. These are genetic variants that might increase your risk of developing preeclampsia. There is research on certain genetic variants being more associated with preeclampsia than others. That's actually the case with most pregnancy complications. That's a really, really new area. So one thing to be aware of is just because somebody has a genetic variant does not mean that it's going to cause you a problem. Okay. Our body has lots of different pathways, lots of different ways of dealing with things. So sometimes having a genetic variant like this genetic variant equals that. Sometimes that's the case. Other times this genetic variant and the body goes, nah, we're going to use this pathway instead. Okay, but we do want to know, if we can, what's there so that we know what may need to be addressed and maybe support some of those other alternate pathways the body can use to get around whatever that genetic variant is. And then really what we want to do is we want to customize recommendations for pregnant people based on those high risk and especially the highest risk areas. So this is where you really want to bring in somebody who's got some expertise. I am working on some ways to help pregnant people through a program to determine some of that themselves, not necessarily for preeclampsia, but for reducing all types of risk in pregnancy. But ideally, especially someone who is high risk, you want to find some functional practitioner, somebody like me or a doctor or midwife or other functional health or integrative medicine specialist who really understands pregnancy and really knows how to bring these factors in and to say, okay, for this patient, for this person in this situation with these risks, what are the most important interventions? What are the most important things you can change for eating, for lifestyle, for making sure that certain toxins are removed from the environment to really make sure that you're reducing the risk as much as possible? And I'm, of course, happy to help with that. There are a lot of states that I can work with people in. Georgia and, well, there's a list of states on my website. For some reason, I'm not getting those off the top of my head right now. But if you're not sure and you want to explore the idea of working with me, reach out and we can talk about that and see what might work and whether or not that would be a good fit. Now, this is how you can contact me. There's going to be references right after this slide. If you want a copy of those references in text rather than in the video, please let me know. Also, I'm basing a lot of this information off of a poster presentation that I researched and presented at the American College of Nutrition Conference back in 2019. So if you want a copy of that poster, you're welcome to get it. Reach out to me as well, or you can actually download it from my profile on ResearchGate. All right, so I'll leave you with those references. Again, please tune in for the remaining 4 parts of this series where we will talk about each of those individual categories in more depth, so we can talk more about what are the specific endocrine disruptors, how can we deal with that possibly, what are some of what are the most impactful heavy metals and what can we do about that? What are the biggest issues around antioxidants? And how can we support, especially during pregnancy, how can we support some ways to, try to reduce the impact that is having? And then, what are some things we can do to support the detox pathways? During pregnancy, I will say that one's going to be a real tricky one. So ideally, we want to try to do that before pregnancy. But during pregnancy, there are a few things that research is suggesting may be safe during pregnancy that we can do that may help in some cases. So again, I look forward to hearing from you if you've got questions about this, and I hope that you tune in to the rest of this series. Please subscribe to this YouTube channel if you want to get a notification of when the next videos are up. All right, well, you have a wonderful, wonderful day, and I will talk to you later.